Great. So for the sake of time, I think we can go ahead and get started. Good morning, good afternoon, good evening, depending on your location. On behalf of the Boost and Ariadne Labs team, very excited to welcome you all to the second live engagement of our Global Mass Vaccination Site Collaborative. Today's topic, I think, is very relevant for many and focuses on funding opportunities to establish a mass vaccination site. So before we get started, just a few housekeeping items. Please be sure to mute yourself when you're not speaking. We really ask that you do this to kind of minimize background noise and feedback while our presenters are speaking. Feel free to also use the raise hand feature if you have a question or a comment that you'd like to share, but I do encourage you to use the chat box for continued engagement with submitting your questions or comments or responding to other participants throughout the session. If you haven't already, now would be a great time to introduce yourself and let us know where you're joining us from. I see some of you have started doing that. Nice to see some familiar names and faces around. Happy New Year to everyone. Great. And for those who may not have heard about the Boost community, thank you for joining us today. This community is a diverse and growing network of almost 2,000 immunization staff from about 133 countries. And so through our online platform, boostcommunity.org, we're able to offer opportunities for our community members to connect with their peers, learn skills that build capacity and advance careers, and lead immunization programs in challenging contexts. And for those of you who may not be familiar with Ariadne Labs, I'll go ahead and actually pass it over to their team so they can share a little bit more about their organization. Over to you, Eric.
Thanks, Yvonne. So Ariadne Labs is a lab based out of Boston. That's a combination of Harvard T.H. Chan School of Public Health and Brigham and Women's Hospital, which is a Harvard Medical School affiliate. We're relentlessly focused on process improvement and implementation and have done a fair amount of work in over 165 countries across the globe. And are really privileged to work with Yvonne and the Boost team and the Gates team to move this work forward. Next slide. So we're going to talk about the Global Mass Vaccination Collaborative. This is a program that's funded by the Bill and Melinda Gates Foundation in a partnership with Boost and Ariadne. And we are focused on leveraging our experience over the course of the last 6 months to 8 months domestically in the United States, along with several other countries across the globe, in addition to the profound experience of the Boost and Sabin Foundation community to help learn together as a community on focusing on mass vaccination sites. So lots of different names for these things, high throughput sites, mass vaccination. But the bottom line is it's about getting vaccines to the people in an efficient way, in a safe way. And our focus is educating and learning about this together, both for policy leaders to help them and make informed decisions on implementation of these sites, and operators, the boots on the ground, to help you be informed and educated and contribute and learn together on how to set up a site, how to do all the sort of components of the site from before the individual hits the ground and goes through the process, vaccine inventory management, satisfaction, safety, and tracking and disposition. So we're really excited about it. We're in the process of launching our new website. The link is at the bottom there, Global Mass Vaccination Site Collaborative. We've got a variety of resources there, in addition to links directly to the Boost community to take advantage of the wonderful resources within the community. And we'd love your feedback. Please provide that in any form or fashion in the chat, email, as we start to grow this, because this site and this community is for you to help you execute on the ground. Back to you, Yvonne.
Great, thanks, Eric. And I just wanted to add, in addition to, well, really as part of this collaborative, we're hoping to offer, bi-weekly live engagements focusing on exploring the various aspects of mass vaccination sites and best practices across different countries. So we have the learning group and we have that website. So we really do encourage you to take a look at that. We have several resources and guidance documents for establishing and operating mass vaccination sites. And now I'd like to go ahead and present the panelists for today. We have Dr. Imran Mirza, who's a health specialist at UNICEF. And then we also have Dr. Mona Kaye, who is a consultant for funding, design, and review for Gavi. And with that, Dr. Imran Mirza, I will go ahead and pass it over to you to start the discussion.
Thank you, Anna. Good morning, good evening, good afternoon, good evening, colleagues, depending from where you are joining. So today's session, we are starting with the 2 poll questions first, and then we move on that one. So the first poll question is, have you considered developing a mass vaccination site in your country? So you can answer yes or no, and this question is open for 30 seconds. Please go ahead with your answers and we'll share the results soon.
We'll give about 30 or so more seconds before we share the results. Thank you, everyone.
Okay, good. So we have the results. About 71% of the participants said that they have considered of establishing the mass vaccination site, and 29% has no. So let's move for the second question, which is, have you previously sought funding to establish a mass vaccination site? So same yes or no answer, and question is open for 30 to 40 seconds. Good. So here we have only 39% who said that they have sought funding for the yes, and majority is saying no. So good that today's session is on the funding. So we will see in the next slides or in the discussions that what are the challenges and why there's no need. So let's, I'll start with presentation on the COVAX. As of latest, still not, I will say latest is 2 weeks old, 92 WHO member states have vaccinated less than 40% of their populations, including around 36 countries, less than 10% as of January 3rd. And we know that our global COVAX targets us to reach around 70% of the population to be vaccinated by June or September of this year. So it's a huge task which has to be achieved by all the countries reaching those global targets and stop the spread of the pandemic and stop that pandemic further. So can we move to the next slide, please? Last year in 2021, we have the challenges in getting a vaccine doses to the countries on the availability. That thing has been changing now. And in coming months, country will start receiving huge quantity of the COVID vaccines. In 2022, we are expecting that around 250 to around 300 million doses will become available for each month. And then the plans targets are that by mid-2022, mid of this year, we should have vaccine to cover at least 45% of all the target populations in the countries. So as the supplies will available, vaccine increases with limited shelf life, distribution will expand, countries will be required to expand their coverage services. So that will be a huge task for countries to take to scale up their distribution and vaccination sites. Mass vaccination sites is a one delivery strategy among the different ones which our countries are doing. Countries are doing through their normal health centers, they are doing campaigns, they are doing outreach services different. So mass vaccination site is slightly different. And I know that in the community, we have the immunization colleagues. So there's a difference between the mass vaccination campaign versus a mass vaccination center. campaigns, normally what we are doing, like measles, polio campaigns, we plan the things, we go ahead for 2 weeks, 3 weeks, 4 weeks, we vaccinate everyone, we move the teams around. Mass Vaccination Center is a part, can be a part of the campaign, but it's typically is a fixed site. Is normally a health center or wherever you uh, establish this mass vaccination site for temporary reasons, where you can vaccinate about 1,000, 2,000, 3,000 people every day, which is not possible in our regular health centers. So that is one of the difference that sometimes people misconceive that mass vaccination site is same as a mass vaccination campaign. So in immunization to high volume sites, and these sites can be established anywhere in the urban areas, like in sport venues, football grounds, any conference centers of any hotels, wherever there's a big space is available, covered space is available, and there they can be established. Some countries has established, converted their mass testing centers into the mass vaccination sites also. So that's also a good approach. In some places, some countries are establishing, developing, structuring the totally new sites. Yes, it is a good site, but it needs a lot of money to establish a new structure. So it's always good that if in the countries you collaborate with the private partners, corporate partners, different agencies, and if there's a space which is available already in the country, that can be converted into the mass vaccination site. And also for the mass vaccination site, you will need a lot of teams, but you cannot have 1 or 2 vaccinators, because if you want to target 1,000 people every day, and then you calculate that the site will be open for morning shift and the afternoon shift. So how many, normally it takes 10 to 15 minutes for each person to come, arrive at the site, get himself person to be registered, screened, and given the vaccine, and then the person has to wait for 15 to 20 minutes, depending on the national policy, after getting the vaccine before leaving the site. So means that we take 10 minutes for the vaccination and then 15, 20 minutes space where they can wait after the post-vaccination period and then leave. So you will need at least 7 or 8 vaccination points in that site. So means that you need a lot of vaccinators, you need a lot of space, and plan the things. These sites will also ensure high uptake in specific populations. So depending where the site has been established, if the site is established close to the residential area, more people will be able to access. But if the site is established to the far off area, people will need a transport to go, and then it may not be possible for the lot of people to come for the sites. So these are the things. So can we move to the next slide, please? As I said, for mass vaccination center or site, you need a planning before vaccines arrives. Also, many countries are receiving multiple products. So not to mix up the different products at the vaccination site is always good, that either you have a different site for a different product, or if you don't have so many available locations, one site, but that site should be clearly demarcated and separated for individual products, because otherwise people will products can be mixed up, and it will be a challenge for the countries to give that vaccine. Also planning that makes vaccine storage conditions more suitable for the site. You will need, because if you want to vaccinate 1,000, 2,000 people in a day, you need a lot of vaccine, and the storage space should be there. You need also to plan what will be the needs of the vaccine, because you cannot have a stock out. We start bringing the people in and there's a stock out, and the people will never trust and they will not come back. So you have to plan very well that your stock should be there at least for a week in the site, so you don't have face any stock outs. Same is a staff. You will need a technical staff and the supportive staff. Technical staff, we know all of us from the immunization community that we need a trained vaccinators, or the people who can give the vaccine shot based on the national policy. Supportive staff will be the people who will handling the security, handling the registration when the people are coming, handling if there's any AFI for the clinical reactions, handling the storage, and all those. These are all the supportive staff which will be required. Then also, NC supplies, that's not only the vaccine, if you want to open a vaccine site center, the huge ones, you will need the tables, you will need the chairs, you need the screens, you will need a lot of equipment. So this also supplies, and we are also working to develop a kind of tentative list of the supplies which will be required. And hopefully in about 2 weeks period, it will be available on the different forums, which can be helpful for the countries to procure those supplies. And then last not the least is the training. Because vaccinators, we know that they are trained to give the vaccine, but if they have a different products, means that vaccinators should be trained for all the different products. What are the requirements for those different products of the COVID vaccines? Plus, for the sporty staff and those people should be trained how to handle so many huge people, queues, registration, everything, and also the data recording, reporting those things. So trainings will be required. Plus, as we are moving ahead in trainings cannot be done only once off. Trainings, you may need to think that you may need to train the people every month, or if the people are turning up, new people are coming up for the different time zones, everyone should be trained. So you need to put in the plan that you may need a multiple trainings in the period of time on those sites. The last one thing that vaccinations, these mass vaccination sites are not like permanent things. These can be temporary depending on your target, how much you want to reach in the community. If you reach that your population, it can be, you can establish this mass vaccination site for a month, 2 months, 3 months, and then you close it down. If you reach your 70% or 45% population, depending what the national NDVP plan targets are. That was my last slide. Thank you. Now I'll move to the next one, move to the Gavi colleague, Mona, because we know that countries will need a funding and looking for the funding for the establishing of these mass vaccination sites. So Gavi will brief what are the funding opportunities are available from the Gavi. Over to Mona. Thank you.
Thank you, Imran. So good morning or good afternoon to you all. Thank you for attending this meeting. So I will be presenting, as Imran said, the Gavi COVAX Delivery Support, or Gavi CDS, and also I will go through the applications pathways. So next slide, please. So the Gavi CDS needs-based window is designed to support countries to plan for COVID-19 vaccine deployment until the end of 2022. We encourage countries to identify current funding gaps in their deployment plans, and we aim to fund at least part of this gap. We are leveraging partners through the Funders Forum to fund all the residual gap. Next slide, please. So there are two pathways to access the Gavi CDS needs-based window. The main one is named the full request pathway. So the purpose of the full request funding pathway is to cover the funding gaps in the country's plan until the end of 2022. So the countries are encouraged to express all their needs in terms of funds, but therefore we do not limit the country with what they can request. So we are not working under ceilings. In addition, we are asking countries to reflect in their budget and in their application form what they have received and what they're anticipating to receive from other partners or other donors, such as the World Bank, the UNICEF, WHO, and others. So for the funding gap that we cannot finance, we will leverage, as I said previously, the Funders Forum. So in order to increase the transparency with our partners, but also in order to try to have this gaps financed by. So all the Gavi 61 AMC countries can apply through this window. if your country is managed by UNICEF, you should reach out to your UNICEF representative, and they will give you information on the UNICEF CTS. We have also the short-term pathway. So the short-term pathway is made for urgent needs that are putting COVAX doses at risk. So if the countries has urgent needs and would like to access the short-term pathway, please reach out to your SCM, so your country senior manager, to see if these funds could be made available for you, and what is the timeline. Next slide, please. Yeah, on this slide, I would like to draw your attention on the fact that detailed guidelines are available on the Gavi website and on the the WHO Partners platform. So on this guidelines, you will find guidance on application modalities, technical assistance, innovation, expenditures, financial reporting, etc. I also want you to have a special attention on the annex of the document. On this annex, you will find concrete example of activities and the classification of these activities to guide country in developing their application. So on the eligible and ineligible costs, you will have really detailed guidelines of what can be funded through CDS and these guidelines that you will find on the WHO Partners platform and the Gavi website. So on this slide, you will see what has been requested by country, like it's a high-level summary of what has been requested by country through the short-term pathway. So in terms of short-term request, we have received to date approximately $5 million requests. So these are really diverse in their nature, but most of the action are often immediate campaign funding or actions to deploy vaccines that are already in country. Next slide, please. So with regards to the full request, the nature of the request is really broader, since we ask country to budget all the gaps in their NDVP or in their deployment plan. So as I told you, we would like countries to include in their application their full gap, to have a full vision of what they need, and also a full picture of which funders will fund what or are anticipated to fund things. Next slide, please. So on this slide, so this is a one-pager with all the very important information on the Gavi CTS needs-based window. So on the left bottom, you will see all the application documents that we are asking the countries to submit to request this funding. And on the bottom right side, you will see all the applications deadline, like the subsequent application deadline to access this funding. So we have deadline for the full request pathway, but please note that for short term, we do not have deadlines. You can really submit when you need the funds, and we will try to disburse as quick as possible. So we don't have a batch or deadlines for this short-term pathway. So I don't know if I should answer the questions right now, because I see several questions. already in the chat.
Yes, I know we do have several questions, and Imran, if you would like to take the lead on that, that would be great.
Yeah, thank you, Anna. So let me have the first question. Was from me. It was not a question, but a comment on Nigeria. Yes, to establish mass vaccination sites, it's good that Nigeria, their partners are supporting, and yes, because at the moment to end this pandemic, we need the support of everyone, and everyone can play its own role. So if partners are supporting for communication, for providing the sites, that is very helpful. So that's a good thing that everyone is contributing. There are some questions for Gavi. Mona, number one was where the guidelines are available. So for you on that one, and also so I think it's available on the Gavi site. And probably what we can do, if you can share the link, we will request the Boost community or Joanna to share with the Boost community the link to the site also.
Sorry, to specify, I was asking specifically about the application form. The guidelines are available, but the actual application form for countries is difficult to find.
Yes, so I see that it's for a short-term application form. So please note that it is the same application form as for full request, but your SCM will guide you on which sections to complete in this application form if you're asking for short-term, and depending on what you're requesting for short-term. So I will put the link to this application form and to the application documents in general in the chat.
Okay, thank you, Mona. There's another question, Mona, from Mariam. How much of the short-term and full request has been dispersed, or how long is disbursement taking place?
Okay, so
lead time for the disbursements.
Here we can see on the slides that I presented the disbursement that has already been completed. Something that you should know is that if you have if you want to have funds in country very quickly, and if you have an HSS funds available, what we can do is disburse part of the to reallocate part of this of the approved amount through the HSS, and of course it will be reimbursed later. So we have very strict targeted timelines for both short-term and full requests. As the short-term requests are not reviewed by an IRC, that the timeline are smaller, but you can request less through the short term than the full request. But we have very strict timelines. We try to disburse as fast as possible, and as I said, there is this opportunity to reallocate some of the HSS funds and be reimbursed later.
Thanks, Mona. There's another question from Anna. Have high volume sites been included in any of the short-term or need-based applications so far? Do we have that information?
So I do not have this information, but I can come back to you later by email, or if I manage to have this information very quickly, maybe through the chat.
Thank you. Another question for Mariam. How many short-term requests can a country make?
So we do not have any limit in the number of short-term requests. So the country can ask for short-term several times if it happens that they have several times urgent needs coming. So there is no limits in terms of number of requests.
Okay, thank you. Another question from Anu. Can a subnational entity submit application?
So
I think this is related with that because normally Gavi applications comes from the government.
Yes.
So probably she's asking if any NGO or anyone else can submit an application.
So this question has already been raised. At the moment, we are asking for the Minister of Health signature for each applications. But if we have some changes on this, it will, of course, be published on the website and on the guidelines.
Thank you. Another one, since this Gavi-driven one would, Anu, can you please clarify? I couldn't understand what you are asking. Is since this Gavi-driven one would assume that they would have informed the appropriate authority in the countries they are. If you are asking that whether this CDS application process is known to the ministry, yes, the answer is yes, because SCMs and the WHO and the UNICEF country colleagues has already informed the countries, and the government ministries of health knows about these opportunities. Is it about that, or you have a different question?
Yeah,
Anu?
that's it. Yeah, that's it. Hi.
Okay,
That's
hi.
it.
Okay, fine. Thank you.
Yeah.
Yes, the Ministry of Health knows about that because as Gavi SCMs are in regular contact with the governments. There's another question from Dr. Anon. Could applications be submitted by organizations? It seems that at present only countries who in the country could apply. We are working in a conflict area where applying via government is impossible. How could we benefit the population? So before we move to the Mona, Dr. Anon, yes, for the conflict countries, there is another mechanism, which is a humanitarian buffer. And there's so that is a mechanism which is going on in which the partners can also apply, but that has to be reviewed separately, not is a separate process for that one. But Mona, over to you for the clarifications on that one.
Yes, so at the moment it's countries who applies, so the API, etc. But no, at the moment it's not organizations, but as I mentioned earlier, if things change, we will publish it.
Thank you. But in the conflict areas, for the humanitarian buffer, there is a mechanism which has been established by the WHO emergency team that some of the organization can also apply, but that application will be reviewed. Because we know in conflict areas where there's no government say or something, there's a problem, there's always a challenge. I don't see any further questions. Fiona, I don't see any further questions, so I don't know.
Looks like we have, yes, thank you, Imran. It looks like we have someone who raised their hand. Teodros, feel free to share your question. Thank you.
Teodros,
Okay.
please.
Yeah. Thank you. Hello, everyone. My name is Tedros from NRO Regional Office UNICEF. Just for clarity, for Imran, is there any kind of standard? How many mass vaccination centers can a country open? Can that be depends on the population or target, if there is any standard? And also number of teams which should be assigned per center, and how long one center should stay, just to at least just to provide full dose vaccination for a person who can start there in the vaccination center. Related with the funding, I want to be clear about that. There are two forms of applications, full term and short term. So this funding opportunity for opening of mass vaccination center, can we include that as short-term application, or we can also include within a full request? Which one is more? I mean, in both scenarios, there are activities which we may need to plan, related activities, not specific for vaccination center establishment. or how can we entertain this? And are there any eligibility criteria for the application of this funding, specifically for the vaccination center establishment? Over, thank you.
Okay, thank you, Teres. Yes, on your first question, for mass vaccination center, it is always preferable to have it in an urban area, because if you are establishing a site where you want to vaccinate 1,000, 2,000, 3,000 people every day, then it all depends on the population that you should have that population to be vaccinated. So they are not practical or they are not economical in a rural areas where there's such a small population. So it depends on what is the population urban, like big cities. Yes, it is very good to have in big cities because there you have to vaccinate. Your target is in millions, so you can have that one in, and it also depends on the number of people and the resources available, that you need one mass vaccination site, you need 2 or 3 mass vaccination sites, depending on the city. So so that depends on your target population, the geography of the city, and the number of people and the resources you have available. The only difference between, we'll say, the mass vaccine center, you can say it is a bigger health, not a health center, it is a big immunization center. Because normally in the normal health facility, there's a 1 or 2 vaccinators which vaccinates 50, 20, 30 people, children per day. In mass vaccination center, if you're planning to vaccinate 1,000, 2,000, 3,000 people a day, you need a big site, you need a number of more vaccinators and more resources. So your question was how many? There's no criteria. It depending on the plan, how many will be required to reach that population, the big number of people. Secondly, for how long? Yes, because other than the J&J vaccine at the moment, all the products need 2 shots and then is a booster shot. So at least the mass vaccine center should be open minimum for 6 weeks. So at least the people who got the first shot, they will have access for the second shot. Otherwise, they will face a problem in getting shot. So if the mass vaccination center can be open for 3 or 4 months or 5 months, where they need that 40-50% of the population has been vaccinated, then the country can consider to shut it down. So it depends on your target and those ones. The questions on the funding, yes, I will move to Mona for that one. Mona?
Mm-hmm. So the distinction within full request and full term is really a question of emergency and also of the size, because of the size of the application, but emergency is the main criteria. So if you consider the request to be very urgent, you can have a short-term request for some specific items. However, if it's really part of the plan and it's like it can wait a few weeks before being disbursed, then you should include it in the full request. It really depends on how urgently you need to get the funds. I don't know if it's clear.
Yeah, maybe. Sorry, if you allow me.
And the eligibility criteria, I invite you all to refer to the guidelines. As I said, Annex 2 of the guidelines have really detailed table on what is eligible and what is ineligible to the CDS funding.
Thank you, Mona. And just to add on, Dr. Rodos, on your first question on the duration, I can give you an example of one of the country which converted the mass testing site into the mass vaccination site last year. And then Ramadan, and they were running that site 24/7, means they were running the 3 shifts, the morning shift, the afternoon evening shift, and the night shift. During a Ramadan, they found that people were not coming at night. They were only coming in the morning. After 3 weeks, 4 weeks, they found that very few people are coming during night. So based on that one, they closed down the night shift. They kept the morning and evening. So this is a temporary fixed site operation. So it depends on how many people are coming at what time and whether it is feasible to run it or not. But main important point is that for this one you need a lot of mobilization, demand, and you should have the availability of the resources, the vaccines and the human resources available so people can come. If a country plans to establish a mass vaccination site and then vaccinate is only 40 or 50 people in a day, then it's not so much practical. That can be done through the normal health center. So that has to be well planned for these ones. It has to be well planned, and that's why there's an opportunity for the countries to apply. Specific funds are required, additional funds are required from the Gavi or the other sources on that one. There's another question from Tina. I want to know if there is a plan to reach and vaccinate target populations faced with security challenges. Tina, if your question is related with the countries in the conflict, yes, as I mentioned before, there's another mechanism for humanitarian buffer, which is a mechanism of last resort. Normally, the advocates to all the countries are required to include all those populations, whether they are in the security areas or conflict areas, to be included in the national NDVPs. They should be reached, and they should have the vaccine, because these are the populations of the country and is the responsibility of the government. But in case if there's any this situation where is a non-state entity is controlling that area and the government has no control on that one, so that's why there's another mechanism which is called humanitarian buffer, and those organizations working in those areas can apply funding and the vaccine through that humanitarian buffer. But that is opportunity as a last resort, but first preference is always that it should be part of the national development vaccination plans. Johnson question, clarification, if organization can have a chance to apply for CDS. I did not get the response. Mona, I think this related with whether the NGOs can apply for the CDS application.
So it's countries that should apply for CDS application, and we need the Minister of Health signature. So we really need this piece to approve the requests, and so it should come from the countries.
Thank you. And also it's related with the Aurangzeb question, can the region or province in the country directly apply for the CDS? Yes, it's not directly, it has to be signed by, as Mona said, it has to be signed by the Minister of Health. That's true, or Mona? Minister of Health. True, or Mona?
Yeah. Yes, well, as long as it's signed by the Minister of Health, as long as it's signed by the Minister of Health, so I can hear me. I don't know how it, the
Mona,
role
I can hear you
now.
clearly. Yes, I can.
Sorry. Yes, so our role is really to get the applications signed in country by the Minister of Health. This is like the information we need.
Yeah, and one of the reasons
sorry,
that we
Imran,
want.
just really quickly.
Yes,
sorry.
please.
I know we have a couple of hands raised. I just want to make sure that we answer everyone's questions. Eric, feel free to go. Looks like you have comments.
Well, thanks so much, Yvonne. The question earlier, and it's sort of, I apologize, I lost track, Firdaus, around implementation and choosing of mass vaccination sites. Just want to put a couple plugs in here. One is I placed an article in the chat, which is really a nice way of thinking about the 5 or 6 sort of key decision points around mass vaccination sites. This work was based on our existing collaborative. We had about 40 sites that were involved, both within the United States, Brazil, India, Haiti, and I maybe miss and Canada. And so that's sort of our early work, and that may help you be informed. It's a short article. The other thing I'm going to place in the chat, and we started off at the beginning, is we heard from you as a community that you're asking for a one-stop shop. So this website that we put the link in that we referenced at the beginning, if you go on that, it's got a variety of different resources, tools, and guides. It's a work in process. We'd love your feedback to make it as user-friendly as possible. For example, hearing, it's hard to find that Gavi link for funding or whatever it may be. We'll find a way to get that on the site so you can have a one-stop shop. Mass vaccination sites are not clearly defined. We're talking about something, we're taking an assumption here that maybe it's over 500 people per day. They can potentially be in existing or adjacent to existing health clinics. It's more about sort of space and supply chain and resources needed. So, it's not a one size fits all. But I would say that my recommendation is the first decision point is on supply and demand. Do you have enough demand within your community, within that urban region, as Imran has referenced, and with a reasonable region where people can travel to adequately, there's access to that site, to be able to deliver, that people will be receptive to receiving 500 vaccines a day, for example. Once you establish that and then get an understanding of that population and their acceptance, then you can then sort of plan out how long you would keep that site open, understanding the different vaccines and the second dose required 3 weeks out in some cases versus a single dose, Johnson & Johnson or others, and then can plan that piece out. It is nice to have that second dose scheduled and administered at the same site. However, you could, if you could only keep that site open for a limited time, you'd have to coordinate with other sites for those individuals to get that second dose. And this is really all about scaling. And the idea is if you can offload clinics who are providing normal healthcare and provide another workforce and another site, then that's the true utility of mass vaccination sites, to be able to offload current clinicians and to get volume in a very, very fast place. So there's a couple references. Check out the website. Love to hear your feedback, and thanks again. Over.
Thank you, Eric. Any other hands? Fiona, I can't see the hands, raised hands.
No, I think that is all for now. I think we can go back to the questions. Thank you, Imran.
Yeah, and just on the back to one of the questions on the funding at the subnational or NGOs, the reason we need Minister of Health to sign that application is we want to coordinate all the applications. We don't want the duplications or overlapping in a country or subnational level. Because, for example, in a subnational area, if Gavi receive 4 different applications from the 4 different partners doing the same thing, it will be a overlap. So that's why we want to coordinate at the country level, at the national level. So whatever is happening at the country, it should be with the permission and in coordination with the Ministry of Health and other partners in the country, so we can avoid any duplications or the overlaps. Over.
Imran, this is Jen. Can I ask a follow-up to that, just to Miriam's question? CDS funding taking at least 2 to 3 months to arrive. For the short-term funding, is that also the timeline of when from application to distribution? Or maybe Mona, that's a question for you.
So we are targeting, well, if you are using the HSS relocation, it takes less than 10 days. It might take less than 10 days. Otherwise, we are targeting less than 50 days, 50 working days end-to-end timeline for the full request, and very smaller timeline for the short term. But of course, it always depends of the quality of the applications and also other factors. But we're really like investing all the resources we can to have really the disbursement made as fast as possible.
Okay, great. And just to clarify, when you said, I think you said HSS, that was referring to, so 10 days for the shorter term funding, is that accurate? And then a bit longer for the longer term funding?
Well, if you use HSS, yes, it's less than 10 days. I would also like to add something. Part of the full request can also be disbursed through HSS if the country is willing to use this process. So approximately 25% of the full request can be disbursed through HSS reallocation. and then we will reimburse the HSS funds. Well, of course, we will need the funds to be available within the country to do this, the HSS funds. And all of the short-term requests can be processed through HSS reallocation if HSS funds are available in the country.
And is the HSS platform different than the CDS platform?
Yes.
Okay, is there I guess just making sure people are all familiar with this, is there a link that you can provide to the HSS platform, or is that different for each country?
Sorry, Jen. Yeah, sorry, let me come in. Number one is I think we are talking HSS. So for the colleagues, booster communities, HSS is health system strengthening funding part of the Gavi. And your question was, yes, HSS is a regular Gavi system where the funds are already in the countries for on the health system strengthening. So Gavi has given opportunity that in case to avoid the delays of the funding approval and the disbursement of the funds and everything, countries can reprogram some of their already available funding in the countries for other activities for the COVID vaccines. So that is, I think Mona is mentioning about reprogramming of the HSS funds. And CDS is especially for the COVID, specific for the COVID, but HSS funds can be reprogrammed for the COVID funding also.
Exactly. Thank you, Imran.
Great, thank you.
Great. I think we have any more questions?
There's some other questions I'm getting. When we talk about that has to be approved by the Minister of Health, it has to be the Federal Minister of Health, not the provincial, because at national level, we want to coordinate because every country has developed their national vaccine deployment plans. So that's why we want to coordinate it at the national level. So applications should be signed by the national or the Federal Minister of Health to be coordinated. Over.
I know it looks like you have your hand raised. Feel free to come off mute.
Hello?
Hello? Yes?
Okay. All right. Can I go ahead now?
Yes, please.
Okay. Thank you so much for the for taking us through this application process. And I'm calling in from Nigeria, and I've seen that Nigeria have actually applied for some streams of funding requests, and that's very good. So I'm speaking from the civil society, the NGO perspective right now, and it's based on the experience and the happenings within our context here. In the last few months, the government have relied a lot on support of civil societies and the non-profits to drive and mobilize uptake of the COVID-19 vaccination. And we've been doing this with little or no funding. And in fact, it has resulted in the recent times into, at the initial time, there was that enthusiastic and willingness to support. But right now, we've also seen that the rate of uptake has gone down a little bit, and more severe government measures are coming up, and it's also leading to some level of hesitancy. But we believe that civil society can do a lot, but we don't really have that resource support or funding to do this in a coordinated manner to able to support the government. So I don't know if Gavi is also hot to non-profits or maybe civil society to support government driving mass vaccination process, and even establishing, because even when you establish it and you don't mobilize people to go uptake the services, especially in regions where there are high level of hesitancy, then that means the investment at that kind of context will not actually give the desired result. So will there be consideration for support to civil societies and, to be able to support governments at national down to sub-national level and down to the community in a coordinated manner? Thank you, and over.
Thank you, Anu. Yes, we know that CSOs, civil societies, are the one of the most important arm of this pandemic control mechanism, and we cannot work without the civil societies. They are doing a lot of work and supporting a lot. So on the Gavi question specifically, I will leave it to the Mona, but I'm sure that as a CSOs in Nigeria also, you must be working with the state level or LG level or the national level coordination committees. And there we can work to, all of us, we can work together because everyone can provide some kind of support. So because governments cannot work alone, they need CSOs, and they are the most important part of that pillar. Over to Mona for any specific questions related with the funding. Over.
Mhm. So we are really encouraging countries to contract expanded partners for the CDS application. So countries in their budget should detail what will be done by who, and then in the disbursement process, we contract the expanded partners. I don't know if it answers the question.
Anu, have you got your answer?
Yeah, yes. But okay, that's fine. And like you said, I think the civil society will continue to explore other means of funding. But I'm not sure. I've not been privy to see what was submitted. But in the culture or tradition or what has been obtainable most time in country regarding government funding, they don't mostly make provisions for maybe sub allocation to civil society or the non-government aspect in terms of giving them. What happened is that some of these things are still done within the context of the government apparatus, and then they will still come back to civil society and say, look, civil society, we need you to go out there, we need you to mobilize, we need you to support us, but there are no funding for you to do that. So we end up looking for our internal funding and contributions to do some of this support. So I don't know whether Nigeria put it in their submission, but the practice has been that they don't normally put such provisions there. They always expect that the civil societies or the non-profits will go out there and source for their own funding. So it might be great that maybe in the next future, even though we have this, there might be a mechanism that whereby civil society opportunity will be given to civil society to apply to support government interventions such as this. Thank you.
Yes, I know. Yes, I fully agree with you. The challenge we are facing and in most of the countries is at the time of the planning. When they are developing the applications, the countries, they don't consider everything, and that's why they missed at that time some of the activities which the CSOs can do it. So that's why we are pushing all the ministry, the SCMs are trying to do that one, that while they are making the budgets, they are making the plans, the CSO should be part of that discussion on the table. So all the activities should be well planned and well budgeted for the applications. Over.
Great, thank you so much, Imran and Mona, and thank you to all our participants for an engaging discussion. As mentioned earlier, we will make sure to kind of have clearer responses to some of your questions, in addition to questions that weren't answered, as a follow-up on the Boost learning group. And before we go over a few next steps, just also want to add that we will be hosting a follow-up session to today's live engagement at the same time next Friday, the 28th. And this will really give participants a chance to ask questions about mass vaccination sites and CDS applications. So be sure to look out for more information on this open forum session by early next week. But in the meantime, feel free to continue the conversation in the chat box. So if you're not a member already, we do invite attendees to join the Boost community to learn more about our upcoming events and engage with peers around topics specifically relating to mass vaccination sites. We also invite you to visit the Ariadne Labs website to learn more about their work and resources that they have available. If you haven't already, be sure to join the Global Mass Vaccination Site Learning Group to get additional information on upcoming events, such as the one that we're hoping to have next Friday. Also on the learning group, you can access resources and tools relating to mass vaccination site operations. Just also want to note that in order to access this learning group, you do have to create a free Boost member account. We would like to also get your feedback and request that you fill out a brief survey so that we can ensure that our future sessions are as useful and relevant as possible. Finally, I'd like to extend a big thank you to our presenters, Imran and Mona, as well as our participants for joining us today. As always, if you have any questions, please feel free to email us at info@boostcommunity.org. And that concludes today's session. Thank you again for a great discussion, and we look forward to seeing you all again very soon. Thank you, everyone.